Nadeen.
See the voice if it is clear.
Gender.
Okay, fine. Now I think it's okay. So all of you, we are back. Chalo, fine. See, if everything is fine, you please write down in chat box. We can continue. See, I have started teaching about what special types of hallucination, which I have taught you: hypnopompic, hypnagogic, anesthesia, functional, and extra-campine, right? Yes. After that, see, I have taught you what? Do you remember here? Yes, very good. Overall, most common type of hallucination overall is auditory, but especially when we talk about organic mental disorder, this is what? Visual hallucination. All right. Now, when I talk about, see here, remember here, whenever there will be any pathology in the temporal lobe, whenever there will be any pathology in temporal lobe, is there can be olfactory or gustatory hallucination. And especially in cocaine intoxication, we have learned about what? Tactile hallucination. Okay, tactile hallucination, right? All this we have learned. Yes. Okay, now the next topic, fourth topic, what we are going to start, that is called as the delusion. Okay, delusion means what? False belief, false form, fixed unshakable belief. See here, see, one most important component of MSE is actually thought. So there are four disorders of thought. One is called as a stream of thought, form of thought, and the content of thought, and possession of thought. If I ask you what are the examples of a stream of thought, see, stream of thought, this is also called as what? Flow of thought. Flow of thought, like flight of ideas, when so many thoughts are coming to the mind, flight of ideas, which is seen in mania, right? Flight of ideas, which is seen in mania. Please keep in mind, flight of ideas. Circumstantiality disorder. What is the meaning of circumstantiality? Giving unnecessary details before the final answer. So these are a stream of thought. Form of thought disorder. Are you able to recall any example of form of thought disorder? Form of thought disorder: derailment, loosening of association, neologism, metonyms, right? And the tangentiality, incoherence, if you are able to recall all these. Now, next important, see here, fourth one is the possession of thought. Here, suppose here, so what are the examples of the possession of thought? Thought alienation, thought insertion, withdrawal, and broadcast. Right now, when a person is having this kind of, see here, so this kind of thought was that someone is inserting some thoughts in my mind, that is called a thought insertion. Someone can withdraw my thought, that is called a thought withdrawal. Okay, see, so many people, all of the people can know about my thought, that is called a what? Thought broadcast. So thought alienation and obsession, these are disorders of the possession of thought. Important is, what is the disorder of content of thought? What is the disorder of? See here, so this is most important. What is actually there in the mind of the patient? What is actually the content of the thought? Okay, here disorder is what? Delusion. Here disorder is delusion. Delusion is a disorder of content of thought. Remember here, overall, most common type of delusion is delusion of persecution. Okay, overall, this is most common type. If any person is having this kind of false belief that someone wants to harm him, someone wants to kill him, this is called as delusion of persecution. Delusion of reference means what? For everything, patient will be referring himself. For everything, patient will be referring himself. Right? To see whatever is happening in and around. Right? No, suppose anything, whatever is happening in and around. So patient will be claiming that this is because of him only. Suppose if he is sitting in a like in a bus, in a public transportation, in a corner, someone else is having any kind of conversation. Now patient will say, oh my God, they are talking about me. This is delusion of reference. Delusion of love means what? Suppose if a rickshaw puller is saying what? Any superstar, any Bollywood actress, only, like you can say, suppose if a rickshaw puller is saying what? Angelina Jolie is his girlfriend. or Aishwarya Rai is in deep love with him. This is what delusion of love, which is also called a fantasy lover syndrome or erotomania. Yes, very easy to understand. And this is also called a 𝗬𝗏𝗏𝗏𝗏 syndrome. Delusion of grandiosity means what? I am the most powerful person on the earth. I am richest. Right? I am richest. I am the president of India, like that. Delusion of negation is important, which is also called as a nihilistic delusion. Nihilistic delusion. What does that mean? This was the question in last INI-CT exam. INI-CT exam. Last time FMGE exam was actually thought insertion. So that was FMG question. See, remember, when anyone is claiming non-existence of any body part, this will be called as delusion of negation. Non-existence of body part. Non-existence of body part. Suppose if a patient is saying what, aliens have stolen my brain, or suppose a patient is saying what, oh my God, my friend yesterday he left to New York and he stole my pancreas. Right? So basically, when any patient is claiming non-existence of any body part, now this will be called as what? Delusion of negation, also called as Cotard syndrome. Delusion of infidelity. Husband and wife cheating on a spouse. Cheating on a spouse. See, whenever a husband is having this kind of belief that his wife is having extramarital affair, okay? Right? So because of this, he will keep on fighting, he will keep on checking her phone. This is called as delusion of infidelity. Infidelity means what? Actually cheating or extramarital affair. Because of this, there will be what? There will be severe jealousy, right? Which is called as, so this jealousy will become disease, morbid jealousy, also called as pathological jealousy. Shakespeare wrote a novel on infidelity, Othello, also called as Othello syndrome. Please remember, delusion of infidelity is more common among male. And during alcoholism also. What is the meaning of delusion of enormity? What is the meaning of delusion of enormity? When any patient who is having this kind of belief that any of his actions can bring a big disaster. Like suppose if he wants to cough, if he wants to sneeze, he will not be sneezing openly. He will be sneezing like this. Like suppose if he has to cough, he will be coughing like this. So basically, why he is coughing like this? Because he will say what? No, I have to cough like this only. If I will cough openly, no, entire city will be blown up. He will not be passing the urine in public place because, okay, he is having this kind of belief that if he passes the urine in public place, there will be biggest flood in the world, right? So basically, what is this? Your patient is having this kind of belief that any of his action can bring a big disaster. Severe feeling of guilt. Severe feeling of guilt. 15 years back, one of your batchmates, he borrowed 1 rupee. 15 years back. Right now when you people are meeting, now you say, oh my God, I could not return your 1 rupee. Oh my God, I've committed the biggest sin of my life. Oh my God, what happened? Oh my God. So this is extreme, right? Remember here, all these can be your one-liner question. Okay. Next topic. Okay. Fifth most important topic, that is called the personality disorder. See, remember here you should know few important points, how examiners are going to frame the question. First of all, please keep in mind, all personality disorders start in young age, adolescent age. All personality disorders are egosyntonic. Basically, they are happy. These people, like, they do not know, like, suppose if they are having some kind of problem, they feel that they are normal, you people are abnormal. Right? So they never want to see any psychiatrist. They don't want treatment as soon as possible. So see, what is the meaning of personality disorders? What is the meaning? When a person is inflexible, rigid, inflexible, when a person is rigid, enduring. I am like this one. If a person will say, I am like this one, if you want to stay with me, stay, otherwise out. Basically, when a person is rigid, inflexible, so do you think because of this kind of attitude, like he will be having good relations? Obviously, no. He will not be able to maintain good relations, right? No. So there will be problem in his personal life, in his family life, in his professional life. This is called as personality disorder. Now, first of all, old classification. Old classification, we should remember here how to memorize all these. Old classification as per DSM-5. Okay, see, DSM-5, basically this has divided all personality disorders into cluster A, B, C. See, cluster A people will appear to be odd. Here we are going to learn there can be paranoid personality, schizoid, schizotypal personality, paranoid, schizoid, schizotypal personality. See here, so actually there are so many features, but you have to keep only few points in the mind. If a person is always suspicious about other people without any reason, he will be called as a case of paranoid personality disorder. This is more common among male than female. Okay, when a person is always suspicious, very sensitive, right now, very sensitive. And you keep in mind when a person is always suspicious about other people. What about schizoid? When a person is emotionally cold and socially detached, what does it mean? See here, like suppose if a person is there, if you are going to appreciate him, okay, fine. If you are going to object him, okay, fine. Basically, he will not be reacting so much and who would like to stay alone, socially detached. Because of this lack of friendship, lack of family activities, lack of sexual activities, this is called as schizoid personality. Schizotypal, everything will be odd. Odd behavior, odd speech, odd dressing, and these kind of people believe in magical thinking. But keep in mind, schizotypal also, these kind of people, whenever they will be in severe stress, they can have delusion and hallucination also, psychotic symptoms also. So in the personality disorder, psychotic symptoms are there, no? So that's why as per a new update, this is no more a personality disorder. This is called as at the borderline of schizophrenia. This is called as at the borderline of schizophrenia. Now, cluster B people means what? Cluster B, keep in mind, in cluster B, I am going to teach you 4 personality disorders. Basically, we are revising very, very fast. That's it. Okay. In cluster B, basically here full of drama, emotional, erratic people. First of all, histrionic. See, in histrionic people, see here, like when I talk histrionic personality disorder, always keep in mind, see here, full of drama and tantrum. After that, attention-seeking attitude. Why full of drama? Because she wants attention. She wants to be the center of attraction, center of focus. Very easy to understand. Full of drama, tantrum, attention-seeking attitude, histrionic. Narcissistic, I'm the best. This is all about me. If you want to talk, okay, fine, speak, but speak about me. Keep on admiring me. Keep on praising me. Excessive self-importance. Excessive self-importance, right? That is called a narcissistic personality disorder, right? So remember here, these people are emotionally fragile also. These people are emotionally fragile. They will not be able to tolerate any kind of even minor criticism. They will not be able to tolerate. Right now, so they can easily go into depression. Antisocial personality, illegal activities, robbery, any kind of like any kind of illegal activities, right? So when I talk about a murderer, obviously he is an antisocial personality disorder person, antisocial, which is also called as a dissocial. But for antisocial, age of a person should be more than 18. Suppose age is equal to or less than 15. If a child is aggressive and violent, okay, so that will not be called as antisocial. That will be when there is a child who is very aggressive, who is very violent, who is harming plants and animals, he will be called as a case of what? Write down. Conduct disorder. Conduct disorder. Okay. Now, remember here, borderline personality disorder. This is also called as emotionally unstable personality disorder. Frequent mood swings without any reason. Self-destructive acts. Keep in mind, borderline personality disorder is favorite topic for MCI people. Okay, favorite topic. Okay, so basically what is happening in the borderline personality disorder? Frequent mood swings without any reason. Frequent fights, easy to get angry. So obviously BPD is more common among females. Self-destructive acts like overdoses of medicine, slashing of wrist. All these you can see in borderline. Next, when I talk about cluster C, remember here, see, all cluster C people, they will be very anxious. They will be very anxious and fearful. Suppose if a man who went for 17 interviews and got rejected everywhere. Suppose if a young man who proposed 17 girls and got rejected by everyone. So do you think these kind of people will be developing the fear of rejection? Yes. So because of this, they will avoid the social gathering. They will avoid other people. This is called as avoidant personality disorder. If a person is always dependent on others, a person seeks excessive amount of advices. Even if he or she has to buy soap, shampoo, pencil, she will take advice. Dependent personality disorder. OCD obsessive. When a person is focusing, when a person is showing more of perfection, obsessed with perfectionism. OCD personality, workaholic people. These kind of people will be looking for minute details. Always keep in mind, for all personality disorders, what is the treatment of choice? Behavior therapy. Psychotherapy is the treatment of choice, but after that, as per the symptoms, you have to treat. If anxiety is there, same like paranoid, so you can give benzodiazepine. If patient is going into depression, you can start with antidepressant. Or if patient is getting hyper maniac, you can start with antipsychotic. So basically, as per signs and symptoms, you can start the medicine. New classification of personality disorder as per ICD-11, it is mild, moderate, and severe. Enough. Okay. Next important topic is eating disorder. In the eating disorder, we should be knowing anorexia nervosa, bulimia nervosa. That's it. See here, basically 6 important topics which we are going to discuss: anorexia and bulimia. Easy to understand? Anorexia and bulimia nervosa. Anorexia nervosa and bulimia nervosa. Remember here, eating disorders are much more common among female because they are image conscious, figure conscious, weight conscious, right? No, so they are image conscious. Okay, they are image conscious. Okay, so that's why what they will do, either they will stop eating or they will eat very less, or even if they are going to eat, right? No, after that feeling of guilty will be there. So after that, what they will do? So they will induce the vomiting. They will induce the vomiting, right? So that they can compensate. So compensatory behavior will be there. Easy to understand? Remember how to differentiate anorexia and bulimia. This will become your question. In this table, I have given everything, but you should know how to diagnose the case. When I talk about anorexia nervosa, see here, when I talk about anorexia nervosa, remember here maximum restriction will be there. What's the meaning of maximum restriction? Like she's eating very less, or most of the meals she skips. So when there will be maximum restriction, so do you think there can be situation like a starvation? Yes. Because of a starvation, do you think there can be deficiency of nutrients in the body? Yes, there can be deficiency of fat, and the protein, and the carbohydrate, vitamins, minerals, sodium, potassium, right? Now, imbalance in hormones like LH, FSH, right? So do you think because of deficiency of all these nutrients, there can be some secondary complications, secondary changes in the body? Yes. Remember here, weight loss, most important thing what you have to keep in mind here, because of deficiency of nutrients, weight loss. LH, FSH imbalance, amenorrhea. Hormonal imbalance, sexual problem, yes. Easy to understand. Remember here, so basically here, see, because of the nutrient deficiency, we can also understand that. See here, so even all the muscles will become somewhat weak. Heart will also not be pumping that much. So there can be a low heart rate, low BP, hypothermia, lanugo. All these we can see in anorexia nervosa. All these we can see in anorexia nervosa. Earlier, there were two criteria to diagnose anorexia nervosa: weight loss and amenorrhea both. Yes, obviously in anorexia nervosa, if female is there, obviously see here, there will be amenorrhea, there will be menses problem for sure. But see, eating disorder can happen to, this can happen to boys also. Obviously no menses problem. So in anorexia nervosa also, maximum 89% patients can have menses problem. So now there is only one criteria, not two criteria. Only weight loss, weight loss, weight loss. Only one criteria is there to diagnose anorexia nervosa. So when I talk about weight loss, we should be talking about what? BMI. BMI, body mass index. When BMI is less than 18.5, 18.5, right? It will be called as weight loss. Weight loss. If weight loss is there, image consciousness, answer will be anorexia nervosa. Keep in mind only this much point. But what about bulimia nervosa? Here more binging. Here more binging. What's the meaning of binging episode? Overeating. Eating beyond fullness is called as binging. More binging and more purging episode, more binging, more purging episode. Right? So basically overeating and over vomiting. So here person is vomiting a lot. But what is happening here now? Here full plate meal. But after 4 to 5 hours, she is realizing, oh my God, I have eaten a lot. After 4 to 5 hours, if she is going to vomit out, do you think there will be a starvation? No starvation. No starvation, no deficiency of nutrients, right? So weight will be normal. No weight loss. Menses mostly normal, sometimes abnormal. Sexual problem? No. Easy to understand. But now you tell me what will happen when a person will insert finger again and again in the mouth. What will happen here? Now there can be erosion over knuckle. That is called as Russell sign. That is called as a Russell sign. This is very, very important. This is very, very important. Right now, the Russell sign. Russell sign. And again, if a person is going to vomit out, yes, metabolic problem, metabolic alkalosis, mouth infection like dental caries, salivary gland inflammation like there can be parotitis. Easy to understand? All these can be seen in both, but these are more common in bulimia than anorexia. More common in bulimia nervosa than anorexia nervosa. But out of anorexia and bulimia, if I ask you which one is more dangerous, which one is more serious, can you answer me? Which one? Yes, anorexia nervosa is more serious than bulimia nervosa. Okay, hospitalization is needed. Hospitalization is needed in anorexia nervosa. Hospitalization is needed in anorexia nervosa, right? See, especially what is the most important thing here? Why you are supposed to hospitalize the patient? Because of weight loss, dyselectrolynemia, right? So basically there can be what? Imbalance in sodium and potassium. So you have to admit. After that, see here, SSRI drug. Serotonin is responsible for good food, good mood, and good sleep. So SSRI we can give a drug which can increase serotonin level. That's it. But overall, most important is what? CBT, behavior therapy. Remember only few points: anorexia, bulimia. Anorexia, bulimia, both are image conscious, but weight loss, anorexia. Normal weight, bulimia. Very easy to understand, right? So overall, one more eating disorder is there, that is called as binge eating disorder. Binge eating disorder, this is most common eating disorder. Binge eating means overeating. When a person loves to eat, foodie people, no? Foodie people. So see, ninth important point, what they can ask, how to differentiate bulimia nervosa and binge eating disorder. Remember here, overall binge eating is the most common eating disorder. Foodie people, where person loves to eat. Foodie people. So obviously, do you think they are image conscious? No image consciousness will be there. No image consciousness. Right? So do you think there will be compensatory behavior? No. But weight, yes, there will be obesity. So how to differentiate bulimia and binge eating? Remember here, when I talk about compensatory behavior in bulimia nervosa, yes. Binge eating, no. Weight is normal in bulimia nervosa. Weight is increased in binge eating disorder. Okay, there is a questionnaire system for eating disorder that is called as SCORP. Please keep in mind. Okay, so these are the points which you should be knowing in eating disorder. Okay, one more eating disorder. See here, psychological appetite for non-nutritive substances. It is called as what? See, a person can eat, soil, air, paper. What it is called as? Appetite for non-nutritive substances. This is called as, this is known as the pica. This is known as pica, right? Okay. Next important topic now is schizophrenia. From schizophrenia, I anticipate minimum 1 or 2 questions. Okay, minimum 2 questions. Okay, see this question now. You try to answer. So basically, see, schizophrenia is very big topic, but most important topic I will be discussing. First of all, about symptoms, about the pathophysiology of the symptom. Right? Okay, please answer. Please answer this question. Try to answer. Okay, this is the 10th important topic. Okay, see, this is what? See, what is the pathophysiology of symptoms in schizophrenia? Okay, you have seen this question. Right, you try to answer. Some of you are marking A, some of you are marking B. All right. Now, see, first of all, I can say, see, now you tell me how many different types of symptoms are there. There can be positive symptom in schizophrenia, negative symptom. There can be disorganized symptom. There can be motor symptoms. Okay, motor symptoms in schizophrenia is called as what? So motor symptoms in schizophrenia are called as what? Catatonia. Catatonia. Okay, this is called as motor symptoms. Motor symptoms. See, suicidal risk is also very high, 5 to 6% suicidal risk in schizophrenia, right? Okay. Now, important is positive and negative. What is the meaning of positive symptom? See, what is the meaning of positive symptoms? Add-on symptom. Add-on symptoms. These symptoms were not there before, but now these symptoms are there in the life of the patient. So see, remember here, so when I talk about delusion and hallucination, delusion and hallucination, earlier patient did not have delusion, after schizophrenia patient is having. So psychotic symptoms are called as positive symptoms. But negative symptoms means what? Loss of normal function. Loss of normal functions. Loss of normal functions. Right? Loss of normal functions. Earlier he used to be very social, but now he's not. Earlier he used to be very talkative, but now he's not talking a lot, right? So these are loss of normal function. So basically minus right now. So these are called as what? Negative symptoms, like avolition, lack of a drive to do any goal-directed activities, apathy, loss of interest, asociality. See, lack of social activities now, right? Anhedonia. What is the meaning of anhedonia? Inability to enjoy. Alogia, silent, loss of speech, affective flattening. All these are negative symptoms. So basically, what is the pathophysiology of the positive symptom and negative symptom? So can you tell me how many dopaminergic pathways are there? 4 dopaminergic pathways. Okay, one is called as mesolimbic tract, another is called as mesocortical tract, then nigrostriatal pathway, and fourth dopaminergic pathway is called what? Tuberoinfundibular tract. Okay, there will be the tuberoinfundibular tract. Remember, only mesolimbic and mesocortical, these are dopaminergic pathways in our brain. Dopaminergic pathways. Okay, so only mesolimbic and mesocortical, these are responsible for symptoms in schizophrenia. Remember here, whenever there will be increase of dopamine in mesolimbic, there will be positive symptoms. Decrease of dopamine in mesocortical tract, there will be negative symptoms. Remember, any patient who is having delusion, hallucination, who is having positive symptom, he will be responding well to medication. So there will be good prognosis. But with the negative symptoms, they will not be responding well to medication. So there will be poor prognosis. Now, very easy to solve these questions. See this question now. Here, very silent, right? Lack of social gathering, lost interest. So these are positive symptoms or negative symptoms? These are negative symptoms, right? So what is the pathophysiology here? What is the pathophysiology of negative symptoms I have taught you just now? Decrease of dopamine in mesocortical tract. Decrease of dopamine in mesocortical tract. Answer will be D. Now there should be no confusion. Very, very important topic I am telling you, right? Please memorize all these. Okay? Very good. Now, see here, how to diagnose schizophrenia, next important topic. Always keep in mind, whenever you are getting very, very big psychiatry question, okay, mostly this will be a case of schizophrenia. Mostly. Remember here, but especially you have to focus on 5 symptoms. Delusion, hallucination, formal thought disorder. I am writing in short, formal thought disorder. What is the meaning of formal thought disorder? Formal thought disorder means like derailment, loosening of association, neologism, and tangentiality, incoherence. All these we have learned. Motor symptoms, negative symptoms. Always keep in mind, minimum there should be how many symptoms? Minimum number of symptoms which should be there, it should be equal to 2. If a patient is having only delusion, he will be called as a case of delusional disorder. Patient is having delusion also, hallucination also, minimum 2 symptoms are there. No, now he will be called as a case of schizophrenia. So when any patient who is having 2, 4, 6, 8, 9, 10 symptoms, this will be called as a case of what? Schizophrenia. Always keep in mind, in schizophrenia, there will be mixture of symptoms. But how much should be the duration of these symptoms? Old classification, minimum 2 symptoms for more than 6 months. Old classification. Minimum, see, there should be minimum 2 or more than 2 symptoms for more than 6 months. But now new classification ICD-11 is more updated. Okay, ICD-11 is saying why to wait for 6 months? If same symptoms like schizophrenia are there for more than 1 month, this is more than enough to diagnose a case of schizophrenia. So you have to look at these 5 symptoms. See, remember here, delusion, hallucination, formal thought disorder, motor symptoms, negative symptoms. Minimum 2 symptoms are there now. Minimum 2 symptoms are there. 100% answer will be schizophrenia, schizophrenia, schizophrenia. Schizophrenia diagnosis is a favorite topic for MCI people. You have to look for minimum 2 symptoms out of these 5, which I have shown you here. Easy to understand? Duration more than 1. Now, same symptoms like schizophrenia. Same symptoms like schizophrenia after any stressor, but duration is less than 1 month. See, if duration is less than 1 month, what it will be called as? This will not be schizophrenia. This will be called as what? Acute psychotic disorder or acute psychosis. Acute psychosis. Please keep in mind. Okay, please keep in mind. Acute psychosis. Next, whenever we are going to start whenever we are going to start the patient on medicines, right now, so there will be some side effects, and most important side effects from where you can anticipate a question is extrapyramidal symptom. Extrapyramidal symptom. First of all, keep in mind, what is the drug of choice for schizophrenia these days? Okay, second generation antipsychotic. Second generation antipsychotic, okay. Out of C, so what is this? C for clozapine, olanzapine, ziprasidone, risperidone, aripiprazole, amisulpride, Q for quetiapine. Remember here, out of all these, when I talk about this drug, clozapine, see, this is the most important antipsychotic, most important. See, this is having least EPS, least extrapyramidal symptom, but maximum weight gain. Maximum weight gain. Remember here, see here, EPS is a maximum with first generation antipsychotics like, and especially maximum with haloperidol. Maximum with haloperidol. So what about second generation? Second generation, so what is the most important side effect of atypical antipsychotic? Metabolic side effect. Metabolic side effect. So what are the metabolic side effects? Hyperglycemia, increased level of sugar, hyperlipidemia, increased weight, sedation, and especially with the clozapine, keep in mind, all these metabolic side effects, one more, there can be cyalorrhea also. Cyalorrhea, excessive salivation, right? Okay. But these side effects are manageable. What are the grave side effects of clozapine? This will become your question. What are the grave side effects of clozapine? Can you write down? What are the grave side effects of clozapine? Very, very important. This will become your question. Granulocytosis, myocarditis, and a seizure. Or granulocytosis means what? Destruction of WBC and neutrophils. So always keep in mind, so before you start a patient on clozapine, CBC is mandatory. CBC is mandatory. You have to do CBC test, blood count you have to check. Remember, whenever WBC is less than 3500 and when neutrophils are less than 1500, please stop using clozapine. Stop using clozapine. Easy to understand? Right. Now, related to clozapine, please write down one more important point. This is also anti-suicidal drug. In psychiatry, there are only 2 drugs which work against suicide. Anti-suicidal drug, only 2. One is the lithium. One is lithium. mood stabilizer. Another is clozapine. Please write down. See, clozapine is a drug of choice for resistant schizophrenia. What's the meaning of resistant schizophrenia? When a patient is not responding to minimum 2 antipsychotics. When a patient is not responding to minimum 2 antipsychotic drugs, okay, he will be called as a case of what? Resistant schizophrenia case, right? Now, what is the drug of choice for this? Clozapine. Okay. Now, let's learn about all extrapyramidal symptoms. Very, very important. From here, last time they have asked one question they have asked, right? So please write down what is the pathophysiology of extrapyramidal symptoms. Remember here, whenever there will be decreased level of dopamine in nigrostriatal pathway, now there can be extrapyramidal symptoms. So yes, obviously this can be because of the side effect of what? Haloperidol. Remember here, when I talk about first generation drug, this is D2 antagonism. But second generation, antagonistic effect towards D2 also, serotonin also. And one plus point, there is partial agonistic effect on dopamine and serotonin. So, see, the function of second generation drug is mainly what? To neutralize the dopamine. That's why in second generation drug, very less or least extrapyramidal symptoms. Remember all these points. Now, what is the meaning of acute dystonia? Please write down: sudden muscle contraction. Sudden muscle contraction. What kind of muscle contraction? Patient can say, sir, I have taken your medicine haloperidol. After that, suddenly I am having muscle contraction of my neck like this. This is called as what? This kind of muscle neck contraction is called as what? Muscle of neck contraction. This is called as this is called as the torticollis wry neck. Okay. See, there can be locking of jaw also. Very good. Christmas. After that, remember here, there can be deviation of eyeball also. See, there can be deviation of eyeball also. There can be laryngospasm also. So basically, this is very, very dangerous right now. So remember here, so how to treat acute dystonia? This was the question last time in FMG. How to treat acute dystonia? You have to give what? Anticholinergic drug or antihistaminic drug, right? Which one? So can you tell me the name of drugs? Please tell me the name of drug to treat acute dystonia. Bolo. Yes, please write down. I'm going to delete some points so that you can write. Okay, fine. So how to treat acute dystonia? Which drug especially you are using it? Either you are using injection of benztropine or promethazine, or even if you are having, see here, so even if you are having what? So diphenhydramine. Remember, this is important. Acute akathisia means what? Restlessness. Acute akathisia means restlessness. When a person will be having akathisia, no, he will keep on moving from here to there, here to there. He will not be able to sit. He will be having so much of anxiety, right? So much of anxiety. What is the drug of choice to treat acute akathisia? Beta blocker. Right? So what is the drug of choice? Propranolol. Very good. Yes. neuroleptic malignant syndrome means what? Neuroleptic malignant syndrome, here patient will be having very, very high fever, very high body temperature, severe body temperature, severe body pain, sweating. If you do blood test, 𝗍𝗵 enzyme will be elevated. Now, so this is what neuroleptic malignant syndrome. How to treat? How to treat? Dantrolene. Now, what about the C? See, what about what is the meaning of tardive dyskinesia? Symptoms like a rabbit-like features. Rabbit-like features. How to treat? You have to start with anticholinergic drug, and after that shift the patient to second generation drug. All extrapyramidal symptoms are important. Okay, no, all these are what? Important, right? Next important topic, how to differentiate Capgras and Fregoli. Capgras and Fregoli. These are called as what? Delusion of misidentification. A real person can appear to be a stranger to the patient, or a stranger can appear to be a real person. Right now? So basically, remember here last time they have asked one question. In which dementia you can see Capgras syndrome? Dementia with Lewy body. Dementia with Lewy body is having maximum visual hallucination, so there can be delusion of misidentification. Actually, what does it mean? Let's understand this. When I talk about Capgras syndrome, here a person is having this kind of belief that a real person is replaced by an imposter. Here patient can say, she is my wife. No. She looks like my wife. She's not my wife. No. She is replaced by a similar looking person. She is replaced by an imposter. This is called a Capgras syndrome, where one person is replaced by another. A is replaced by B. You can remember like this. Where one real person is replaced by an imposter. How to understand? How to memorize it? In a football ground, natural grass is replaced by artificial grass called as Capgras. Easy. Where one is replaced by another, this is called as Capgras. But Fregoli, here patient is having this kind of belief that one person can change multiple appearances. Here patient can say he is a beggar. No, he's not a beggar. He's my brother only. My brother, he has taken the appearance of a stranger. Now he is disguising me as a stranger, as a beggar. Okay, this is called a Fregoli, where patient is having this kind of belief that one person can change multiple appearances. Multiple appearances. Okay, same person can change. See, one person can change multiple appearances. That is Fregoli syndrome. Easy to understand? Next, 14th important topic related to sleeping disorder. Related to sleeping disorder. Okay, Dr. Arvind, no issues. This is common to everyone. Huh? Related to sleeping disorder, I anticipate a most important topic. First of all, see, as you know that there is a REM cycle and non-REM cycle. Rapid eye movement, non-rapid eye movement, we have learned all this in the sleep physiology. Rapid eye movement, when a person is sleeping for 8 hours, he will be spending 6.5 hours in non-REM, which is a deep sleep. Okay, and only 1.5 hours in a REM. Suppose if a person is going to see any dream, he will be able to recall the dream when he will be seeing the dream during REM. But during non-REM, person will not be able to remember anything. Person will not be able to remember anything. So what are the abnormal events that occur in deep sleep? What are the abnormal events that occur in deep sleep? Okay. First of all, extreme level of horrible dream, which is called a pavor nocturnus. Remember here, milder form of horrible dream is called as nightmare. Nightmare is seen during REM. Person will be able to recall. Nightmare and the terror, both are different. Okay, so Maximum level of horrible dream will be seen during non-REM. Sleepwalking, which is called as somnambulism, person will not be able to recall anything. Bruxism, which is called the teeth grinding. Somniloquy, see somniloquy during sleep if a person is speaking. Sleep-related enuresis, bedwetting. What is the drug of choice for bedwetting? What is the drug of choice? Desmopressin is the drug of choice. Desmopressin. But what about, see, suppose if examiner is asking you overall what is the treatment of choice for a bedwetting? It is bed alarm. It is bed alarm. Okay, it is bed alarm. So extreme level of horrible dream means what, Dr. Arvind? Extreme level of horrible dream means what? When a person is in deep sleep, when a person is having any kind of horrible dream, after that he or she will be having what? Severe palpitation, tachycardia, surging. After that he or she will be screaming a lot. After that he or she will get up, and then but he or she will not be able to recall what happened, right? Extreme level of horrible dream, no? So there will be what? Severe palpitations and tachycardia, right? Okay. Remember here, see here, so what kind of question examiner can frame? Out of these parasomnias, which one is seen during deep sleep or light sleep? Like this, one question, very, very important. What is the gold standard investigation? What is the gold standard to study sleep pattern or sleep study? Polysomnography, right? That is called as, okay, that is called a polysomnography, where we have to check what EEG waves, also ECG waves, all kind of movement, ocular movement, SpO2 saturation of oxygen in polysomnography, right? Remember here, next important topic from sleep physiology, which I anticipate this time in FMG, because last time this was the question in INICT. Okay, this I'm anticipating it. Remember, when I talk about a non-REM sleep, no, there are 4 stages. Stage 1, see, I'm talking about NREM. Stage 1, then a stage 2. After that, there will be a stage 3 and then a stage 4. Okay. See, a person is spending only 5% time in a stage 1. See, basically, when you are going to fall asleep, start beginning phase is stage 1. So there can be the jerky movement. Jerky movement is stage 1. If you are sitting in the classroom, if you are sleeping, no, and any of your friend is going to push you like that. After that, if you are doing like this, no. So this kind of jerky movement is seen in stage 1. After that, 45% stage 2. Maximum time a person spends in a stage number 2. Stage 3, 25% and 25%. After that, there will be a REM. There will be a REM. In one night, there will be 4 to 5 REM cycles. From here to here, it will take, see, approximately 90 to 100 minutes. This duration is called as a REM latency. This duration is called as REM latency. REM latency. In narcolepsy, what is happening here? In the narcolepsy, see, in narcolepsy, what happens? See, reduced REM latency. It will be less than 60 minutes in narcolepsy. That's why a person keeps on getting up again and again, again and again. So what is the hallmark of narcolepsy? Reduced latency of REM sleep. Okay. Now the new classification, this is called as N1, this is called as N2, and altogether this is called as N3. Remember here, now you have to know about this. See, spatial waves. Some burst of waves we see in stage number 2. Okay, this is called as sleep spindle. And high amplitude, like, okay, this is called a K complex. Repeatedly asked question. Sleep spindles and K complex are seen in which phase of sleep cycle? Non-REM stage number 2. Important question. Okay, which type of wave you are going to see during a REM sleep? Sawtooth appearance like this. Okay, sawtooth appearance, please write down sawtooth waves, and these two you have to keep in mind, very, very important, very easy to understand, right? See, in pharmacology, you should revise about the drugs for insomnia, right? For insomnia, we can give benzodiazepine, but always remember here for see, overall, whenever we talk about benzodiazepine, no, all benzodiazepines have dependency. Benzodiazepine we should be using only for 2 to 3 weeks. Only for 2 to 3 weeks. Okay, only for 2 to 3 weeks, because after that there is high risk of dependency, addiction. That's why we are having Z compounds now, Z compounds. This you have to memorize. How many drugs are there in Z compound? There are 3: zaleplon, zolpidem, 𝗏𝗏𝗏. Shortest acting, moderate, and longest. Zaleplon, zolpidem, 𝗏𝗏𝗏𝗏. This question you can anticipate in pharmacology. Okay, no? Z compounds, very easy to understand, right? We can also give the ramelteon melatonin agonist receptor, right? Next, 16th most important topic, what I anticipate, how to diagnose depression or mania. Okay, depression or mania, how to diagnose? This can become your question. Remember here, if a patient is having, see, suppose if a person is having only depression, major depression, he will be called as a case of unipolar disorder. Okay, now major depression with mania, it is called as bipolar. Remember here, depression can occur alone, but mania, remember here, depression can occur alone. If a person had depression for 4 years, he will be called as a case of unipolar depression. But once he is getting any episode of mania, now he will be called as a case of bipolar. Once a person is bipolar, he is always bipolar. So even if examiner is writing mania, mania means bipolar. Okay, hypomania, milder form of mania. Cyclothymia, milder form or less severe form of bipolar disorder. Dysthymia, milder or less severe form of major depression. Okay, you have to memorize these definitions. When I talk about major depression, major depression, please remember here, major depression, this is more common in females. Okay, what is the age? Middle age. Middle age, after 35 years. Okay, but when I talk about bipolar, when I talk about mania, this is more common among men, almost equal but slightly higher among men. This is young age. This is young age disorder, mania. Okay, remember for major depression, obviously there will be what? Decreased level of serotonin, norepinephrine, and decreased level of dopamine. But when I say mania, right now, when I say mania, yes, there will be what? Increased level of dopamine. Easy to understand? I hope all these points are clear. First of all, how much is the duration criteria for this major depression? Symptoms should be there for more than 14 days. Bipolar disorder, symptoms should be there for more than 7 days. Hypomania, 4 days. Cyclothymia and dysthymia for more than 2 years. Duration criteria is important. For major depression, what will be the symptoms? Lack of mood, lack of food, lack of sleep. So obviously weight loss, lack of energy, lack of concentration, lack of attention, negative thoughts, anhedonia, suicidal thoughts, obviously suicidal thoughts, right now. So remember, for major depression, minimum there should be how many symptoms? Minimum there should be 5 symptoms. Weight loss, easy to understand. In this manner, you can easily differentiate, you can easily diagnose the case of depression, right? But suppose if examiner is going into the deep of the topic, now there is further classification of depression. One is called the typical depression, atypical depression. Typical depression, atypical depression. You have to keep only few points in mind. Typical depression means what? Person will not sleep, person will not eat. Right now, in typical depression, you can remember only few points. In typical depression, lack of mood, lack of food, lack of sleep. So weight loss will also be there. But there is a type of depression where there will be reversal of biological symptoms. Here a person will be eating a lot, hyperphagia, sleeping a lot, hypersomnia. Because of this, there will be weight gain. Please remember only this much point. Obesity will be seen in atypical. Weight loss will be seen in the typical depression. Keep in mind only these points. You can easily differentiate typical and atypical. One melancholic depression, old age depression, that's it. Please memorize all these points. You can solve all the questions. Remember here, for all the depression, for all kind of depression, break now. Just a minute. Okay, see here, we can take a small break just for 5 minutes. After that, we will continue. Yeah. Okay, fine. We can start now. See, देखो. So always keep in mind for any kind of depression, always remember here, see the drug of choice is SSRI. See the drug of choice is what? SSRI. SSRI is the drug of choice. But for atypical depression, first drug to be given is MAO inhibitor, monoamine oxidase inhibitor like 𝗬𝗪. Okay. Now, how to see here. So what is the meaning of double depression? When a patient was, suppose if a person was having dysthymia. So what is the meaning of dysthymia? Milder form of major depression is called as dysthymia. Now there is a superimposition of major depression. Now there is superimposition of major depression. So basically, see here, dysthymia with major depression, or the, or you can say sandwich of two depression is called as double depression, right? Now, rapid cycling, if a person is having minimum 4 episodes of bipolar in 1 year, minimum or more than 4 in 1 year, this is called as rapid cycling. Okay, next important topic. Yes, you can anticipate a question from, say here, how to manage depression. Most of the time, what they will do, most of the time, they will write the name of medicine like fluoxetine, sertraline, escitalopram. Remember here, SSRI is their drug of choice. If SSRI is not in the option, then you can mark SNRI. See, SNRI is what? Serotonin, norepinephrine reuptake inhibitor, like 𝗵𝗲𝗃𝗃 and desvenlafaxine. Question is that, when will you take a decision to start the patient on SNRI? When patient is having lack of motivation, lack of energy, and lack of drive. Okay? Remember here, question is that, now when we talk about TCA, like imipramine, amitriptyline, amoxapine, right? See here, see earlier this was the drug of choice, but these days actually when we talk about TCAs, no, these are actually what second line drugs. Second line drugs. Why? We are going to understand. We are going to understand now. See, one, we are going to talk about monoamine oxidase inhibitor. Second, we are going to learn about TCA. See here. So this is an important topic which I'm expecting. Okay, what is the meaning of this reaction? I'm sure you would have learned in your pharmacology also. What is the meaning of 𝗘𝐶 reaction? When a patient is already on monoamine oxidase inhibitor, when a patient is already on monoamine oxidase inhibitor, what is the name of drug? Any drug? Selegiline, right? When a patient is already on monoamine oxidase inhibitor, he should not be taking some food beverages. Which one? Cheese, red wine, and beer. Why? Because there is a product that is called as what? Okay, that is called as the tyramine. Right? Remember, this is having sympathomimetic activity. If a normal person is going to consume cheese, beer, red wine, okay, see, there can be easily, so there can be digestion of tyramine because of monoamine oxidase, which is there in the GIT. But if a patient is already on monoamine oxidase inhibitor, after that if he is going to consume these products, now what will happen? There will be release of tyramine in blood, and then it can cause what? Severe lethal hypertension. This is called as 𝗘𝐶 reaction. This is called as 𝗘𝐶 reaction. This question you can anticipate. Last time also this question was there. How to treat phentolamine? What about TCA? TCA toxicity, lithium toxicity, 𝗘𝐶 reaction, extrapyramidal symptom. Out of these four, 1 or 2 questions will come for sure. Lithium, TCA, 𝗘𝐶 reaction, and what? TCA toxicity. See here, so what are the drugs we have done in TCA, like amitriptyline, amoxapine, imipramine? So what is the problem with the TCA now? So TCA was blocking. When I talk about TCA was blocked. When I talk about TCA, remember here, see actually, TCA was blocking serotonin, norepinephrine. So because of this, this was increasing the level of serotonin, also norepinephrine also, fine. If only this much was there, now my patient would have been happiest. But TCA was also having antagonizing effect on muscarinic receptor, alpha 1, alpha 2, histaminic receptor, okay, sodium gated channel of heart, and this was also causing metabolic acidosis. So now do you think because of this there can be secondary side effects now? Yes, now there can be multiple side effects. What my patient is saying, कि Dr. Sahab, the medicine what you have given, amitriptyline, after that I cannot see clearly. I'm having difficulty in passing the urine. This is because of what? This is because of what? Anticholinergic. So this is because of what? Muscarinic receptor. Only serotonin and norepinephrine, good. But side effects because of muscarinic receptor, no. There can be blurred vision, urinary retention. There can be severe constipation. There can be constipation, right? Constipation. Okay. Mydriasis. Right? Okay. Fine. See, due to alpha blockade, now patient is saying what, sir, every time, like I'm having what, giddiness, right? So there will be low BP because of alpha blockade, hypotension. Because of sodium gated channel, now patient will be having what? Arrhythmia. Neurological side effects because of excess of serotonin. There can be mental confusion. There can be seizure. Right? Metabolic acidosis, obviously very, very serious. So my question is that, see, a TCA toxicity, one question you can expect, you can anticipate. Okay? Like examiner can give the name of drug, or examiner can say a patient has consumed multiple pills of antidepressant, right? And these symptoms are there. Or which investigations are supposed to be done in a case of TCA toxicity? ECG mandatory, ABG mandatory. In ACG, everything will be elongated, like there will be PR interval, QRS interval, right axis deviation. Okay, how to treat TCA toxicity? Can you answer me? How to treat TCA toxicity? Since there is metabolic acidosis, no, blood is acidic, you have to make it alkaline. So how to treat TCA toxicity? Serum alkalinization. You have to give injection of IV injection of sodium bicarbonate injection. Very easy to understand. Okay. Overall, what is the most common side effect of SSRI? Can you answer me here? SSRI side effect? Sexual side effect. Whenever any drug which is going to increase the level of serotonin, this will be having sexual side effect for sure. Okay. So what is the sexual side effect? Delayed ejaculation. That's why SSRI is given for the premature ejaculation. Okay. Next topic. So we have completed 19 topics. Now, what about the 20th? After delivery, mood disorder. Important topic for exam. Postpartum blues, psychosis, and depression. See this question and now you try to answer. See this question and try to answer. Okay. See, when I talk about postpartum blues, overall, this is most common. Okay, 75%, and postpartum depression up to 10 to 15%. Least common is postpartum psychosis. Dr. Rahman, like FMT class will also be there. Okay, that will be announced. I think on 18th it is there. I think so. Okay. So remember here how to differentiate. Okay, some Dr. Arvind, you have marked actually B, right? Let's solve this question. See, postpartum blues means what? This can occur within first week, within 3 to 5 days. Okay, do you think there will be the tearfulness? Yes. Sleep problem? Maybe. But do you think in postpartum blues is very, very common. Okay, just after delivery of a baby, there will be imbalance in hormone. No, so yes, fluctuation of mood can be there. But no suicidal tendency. No thought of harming the baby. No risk of depression. How to treat mother? Only emotional support. That's it. But postpartum depression is very, very serious. Postpartum depression can occur in how many days? This can occur within 90 days. So it is having long duration. Within 3 months, postpartum depression, sleep problem, yes. Insomnia, yes. Anhedonia, yes. Suicidal thought, yes. Thought of harming baby, yes. Risk of depression, everything is yes. Everything is yes. It is called a postpartum depression. How to treat antidepressant with psychotherapy? Remember here, symptoms of postpartum depression with delusion or hallucination. Psychotic symptoms will be there, no? When psychotic symptoms will also be there, then it will be called as postpartum psychosis. Postpartum psychosis. Here what she is claiming? She is claiming that her baby is stolen from her womb. Nihilistic delusion, no? And see, dekho, remember here, this is a case of what? So here, delusion is also there. One important point you should know, the duration when it can happen. When I talk postpartum blues psychosis, BPD, postpartum blues within 3 days, psychosis within 3 weeks, depression within 3 months. Remember like this. So here, nihilistic delusion, and see the duration also. First, most important is symptom, after that duration. So answer is postpartum psychosis. Postpartum psychosis here, psychosis, because see, nihilistic delusion is there. Okay, see, next topic is how to treat acute mania. This is important. See, if I ask you one question, how to treat acute mania? What is the first? Suppose, see here, overall, what is the meaning of mania? Hyper. When a person is over talkative, flight of ideas, very distracted. Okay, no, when a person is speaking a lot, right? He's working a lot. He's not at all sleeping. He's sleeping only for 2 to 3 hours. And after that, he's very comfortable, full of energy, over shopping, foolish business investment, right? Over donation. So basically, when a person is hyper, he will be called as a case of mania. So remember here, when you are getting acute mania case, what is the first drug to be given? Catatonic symptoms are completely different, Dr. 𝗵𝗵𝗀𝗀𝗃, you know. Like there will be what, like motor symptoms, like in schizophrenia, like sometimes a person can be standing like this, or like this, right? Moving like this. So these are actually motor symptoms. These are motor symptoms. And the motor symptoms are very different, like maxillary flexibility, catalepsy, posturing, right? No, like sometimes like stereotyping, mannerisms. So what is the first drug to be given in a case of acute case of mania? Acute. Remember here, if you are thinking lithium, how much is the half-life of lithium? How much is the half-life of lithium is 1.3 days. 1.3 days. So any drug is going to achieve plasma concentration after 3 to 4 half-lives. Lithium will achieve plasma concentration only after 5 to 7 days. What does it mean? If you are starting lithium now, it will start acting after 5 days. So on the beginning, on day 1, it will not be beneficial. If you want to start benzodiazepine, okay, so benzodiazepine will give only sedative effect. But he is hyper, he is shouting now, he is hyper now. What is the first line of management? First, we should start with antipsychotic. First drug, please write down this question. I'm anticipating this time. First drug in a case of acute mania is antipsychotic. We can start with olanzapine. Remember here, antipsychotic should be stopped after 2 to 4 months. Benzodiazepine should be stopped after or within 2 to 3 weeks. Lithium can be continued. This can be continued alone for 9 to 12 months. Please remember. So first drug to be given for acute mania is what? Antipsychotic. Along with antipsychotic, we can add lithium and benzodiazepine. So this See here, I anticipate this as the most anticipated question in upcoming exam. First, a drug for acute. Okay. Okay. So basically, see here, remember here when I talk about lithium, lithium is a notorious drug. For this, you have to keep on doing TDM. You have to do therapeutic drug monitoring. So first blood sample should be taken after how many days of starting the patient on lithium? Dr. Arvind, even during pregnancy, we can give lithium. We should continue lithium. We should continue lithium. Remember here, first blood sample should be taken only after 5 days. After 12 hours of last dose. Please remember all this one. First blood sample to be taken after 5 days, after 12 hours of last dose. Now solve this question. Suppose if you are getting a patient of bipolar disorder, but now patient is having only depression. So basically you have a patient of bipolar depression, symptoms only of depression, but he's a known case of bipolar. Can you start only antidepressant? Answer me yes or no. Only antidepressant will be enough. Remember, if you start only antidepressant, no, patient will improve. He will improve more and more. After that, he will start having what? Hypomanic episode. So this will be called as what? Drug-induced hypomania. So in a case of bipolar depression, antidepressant monotherapy should never be started. Antidepressant should always be combined with the mood stabilizer. Okay, antidepressant should always be combined with mood stabilizer. What is the first line of management in acute mania? Can you answer now? First line of management in acute mania? Antipsychotic. Next question. See, lithium during pregnancy, answer me yes or no. Yes, lithium can cause abstinence anomaly, but the risk is very, very less. So yes, we can continue lithium during pregnancy. Even during lactation also, yes, because there are more beneficial effects. Safest mood stabilizer during pregnancy. Which one? Lamotrigine. Lamotrigine is safest mood stabilizer. Okay. See here, mania can be of two types. Euphoric mania means when a person is laughing, when he is very happy and hyperactive. Dysphoric, when person is shouting, irritated. Dysphoric mania. Drug of choice for euphoric mania is the lithium. For dysphoric mania, it is valproate. Minimum duration for the treatment 9 to 12 months. Please remember all this point. Okay. Next, yes, lithium toxicity, very, very important. Lithium toxicity, okay, 22nd topic for today. See here, how lithium is very, very toxic. Why it is? See, overall lithium is the gold standard mood stabilizer, best mood stabilizer. But we have to keep on doing the drug monitoring. Because the lithium is notorious also because of its therapeutic index, which is very, very narrow. So please write down safe or maintenance dose of lithium. Okay, this is 0.6 to 1.2 milliequivalent per liter. Remember here, if it is more than 1.5, now there will be signs of toxicity. So keep in mind, whenever you are starting a patient on lithium, it should always be less than 1. It should always be less than 1. Okay. If there will be more than 3 milliequivalent per liter, there will be permanent neurological deficit. And after that, dialysis will be mandatory. More than 4, death. So remember, in extreme condition of lithium toxicity, dialysis you are supposed to do. Dialysis. How there will be complications? CNS. Okay, there will be pores. Endocrine, this will cause what? Hypothyroidism. hypothyroidism, GIT, nausea and vomiting, renal. Please remember here, see, lithium will cause polyuria, then polydipsia. After that, it will cause what? Diabetes insipidus, right? So nephrogenic diabetes insipidus, yes. Skin problem, red rashes and folliculitis. What about teratogenic? Upstream's anomaly. Please remember, TCA toxicity, lithium toxicity, cheese reaction, and all side effects of antipsychotic, especially extrapyramidal symptoms. Please revise. Next, okay, see, when I talk about the 23rd topic here, see, from the sexual disorder, first question which I anticipate that can be related to paraphilia, abnormal way of sexual gratification like sadism, masochism, bestiality, voyeurism, exhibitionism, necrophilia. I have taught you. So like in the notes, please revise all paraphilia. I anticipate one question from paraphilia. But the most important what I anticipate, this is, see here, one is called as premature ejaculation, another is called as erectile dysfunction. How to manage these cases? This I anticipate more than paraphilia, but you should revise paraphilia also. What is the definition of premature ejaculation? After insertion of penis into vagina, if there will be ejaculation within 1 minute, it will be called as premature ejaculation. So first of all, behavior therapy, squeeze technique and stop-start technique. Please memorize this. Squeeze technique means what? You are giving instruction to the patient that whenever you feel that you are about to come or there will be ejaculation, apply a pressure over glands so that there should be backflow of semen and you can increase the duration of sexual intercourse. The stop-start technique, whenever you feel that you are about to come or there will be ejaculation, stop, restart, stop, restart. In this manner, you can increase the duration. So squeeze technique and stop-start technique, which is also called as Simmons technique, this is for premature ejaculation. If these techniques are not working, which medicine you can give, especially SSRI, see, especially duloxetine and paroxetine. Now, when I talk about erectile dysfunction, 90% of erectile dysfunction are psychological. So see here, so when there will be good blood flow to the penile organ, to the penis, there will be good erection. Lack of blood flow to the penis, lack of erection. So give any medicine which can increase blood flow to the penis. Phosphodiesterase inhibitors, sildenafil, vardenafil, and the tadalafil. Phosphodiesterase inhibitors. It is going to increase blood flow to the penile. There is only one injectable drug for erectile dysfunction, that is alprostadil. Where do we inject? Either urethra or corpora cavernosa. See, in sexual disorder, these points are more important. After that, please also revise. You have to revise all paraphilia. Okay. Next, when I talk about the neurotic disorder, most important topic: how to differentiate panic disorder, PTSD, acute stress disorder. Remember here, when I talk about anxiety, overall, what is the meaning of anxiety? See, anxiety means nervousness, restlessness. Okay, nervousness, restlessness. After that, so basically, see here, nervousness, restlessness. There can be tachycardia, like increased frequency, like urination. There can be cold skin. There can be sweating. All symptoms of anxiety with the symptoms of heart attack is called a panic. First time attack, after that same symptoms, so this will be called as panic disorder. Remember here, so basically whenever, so after any situation, or maybe like after any mobile phone, Like suppose if a person is having severe pain in chest, severe what shortness of breath, after that what's here? Severe pain in chest, shortness of breath, severe palpitation, palpitations will be this much high that person will say, that patient will say, oh my God, doctor, I can feel my heartbeat, it seems my heart will come out, oh my God, I'm going to die. Fear of dying, which is called as, you see here, feeling of impending doom. This word you cannot forget. Fear of dying you cannot forget. Feeling of impending doom, examiner will mention this. Okay, fear of dying, fear of losing control. After that, all other symptoms will be there for sure. So remember here, this is called a panic disorder. Minimum there should be 4 symptoms, and this is very common among young age, more common in female. What about PTSD? After any trauma, if there is a stress disorder, post-traumatic stress disorder, right? After any accident, after, you know, like after any murder, like suppose if a person has seen any kind of murder or any kind of horrible thing, right? Suppose if see, remember, a PTSD is much more common among females, much young females, young disorder. PTSD is young disorder. A 19-year-old female, she went airport to receive her parents. Right? She got very excited when she saw that the flight was about to land. She got very excited, very happy, but suddenly during landing there was plane crash. She was allowed to go inside. When she went inside, she could see the separated head of her father from his body. Do you think she will be having flashback and nightmare every time? Yes. The flashback and nightmare you have to keep in mind. Every time she will be having flashback and nightmare. Obviously after that she will not be able to sleep, no good mood. She doesn't want to go to airport again. She will not be able to speak again. Right now, basically she will be having what? Startle response. She will not be having normal speech. Right? When symptoms are there for more than 1 month, it is called as PTSD. Same symptoms like PTSD, but duration is less than 1 month. It is called as acute stress disorder. Last time FMG question, acute stress disorder, less than 1 month. Okay. First line, how to treat SSRI first line. But what is the overall treatment of choice? Behavior therapy. Easy to understand. You are not going to do any mistake here. One is called as adjustment disorder. What is the meaning of adjustment disorder? Remember here, after death of any loved one, loss in business, loss in family, or a long-standing disease like cancer, when patient is having some symptoms of depression with symptoms of anxiety, and person doesn't want to go out, right? Person wants to stay alone in there because he is not able to adjust in the normal environment. This is called as adjustment disorder, most common psychiatric disorder in a cancer patient. Yes, for any kind of phobia, remember, if I have to treat any kind of phobia, what is the main line of management? Can you answer me? Any kind of phobia, like there can be claustrophobia, fear of closed space, nyctophobia, fear of dark place. So remember here, any kind of phobia, behavior therapy, that is what? Exposure therapy. Any patient who is having, like, you can say glossophobia, fear of public speaking, you have to expose him to anxiety provoking stimuli. Suppose if any of your friends who is suffering from glossophobia, you can keep on pushing him on the stage again and again. Basically, behavior therapy. Remember here, agoraphobia, I anticipate this time. Only fear of closed place, claustro. Only dark place, nycto. But mixture of phobia is there. Either fear of open, fear of closed, fear of crowded, fear of being alone, or fear of using a public transportation. If minimum or more than 2 fears are there together out of these 5, this will be called as what? Agoraphobia. Fear of open also, closed also. Agoraphobia. This is called a what? Agoraphobia. Agoraphobia. So for any kind of phobia, what kind of treatment we are going to use? Remember here, for any kind of anxiety, even a phobia is also a type of anxiety. Remember here, how to treat any kind of anxiety. First drug SSRI. Along with this, you are adding benzodiazepine. Examiner can ask you, what is the purpose of adding benzodiazepine? Benzodiazepine will give what kind of effect? Calming effect. You can also add beta blocker. Right. Remember here, whenever a patient will be started on SSRI, see, SSRI can start working. See, this can take some time. Sometimes it can take up to 2 to 3 weeks. Right now, so maybe you know, like suppose when a patient is already on SSRI, so after 2 weeks, after a few weeks, he will start having the response. Okay. Next topic, okay, 26th topic, OCD is an important topic. OCD means what? Obsessive and compulsive disorder. Okay, first of all, it is what? Ego dystonic. Ego dystonic. Obsession means what? What is the meaning of obsession? Uncontrolled thoughts. If a person is getting this kind of thought that your hands are dirty, wash it. Uncontrolled thoughts, these thoughts he is not able to control. He's not able to control, right? He's not able to control. So actually he knows it that these thoughts are weird. Insight is present in OCD. He knows that these thoughts are weird, but he's not able to control. So whenever he wants to resist whenever he wants to resist, like he's getting anxiety. Simply to release the anxiety, he has to wash their hand. So this action is called as compulsion. Action is called as compulsion. Here patient knows that because of his OCD, he is wasting so much of time, energy and money. So he can easily go into depression. Along with OCD, depression occur. There is imbalance of serotonin also. Especially serotonin imbalance in OCD. So which drug we are going to give? First of all, behavior therapy plus SSRI. Which behavior therapy? Exposure and response prevention therapy with SSRI. Remember here, this time, see here, OCD, how to diagnose? First, OCD of contamination, washing hands. Again and again, if a person is going to check the lock, whether he has locked or not. OCD of pathological doubt. But when a female is going to cut vegetable, she wants to maintain shape and size of each vegetable equal 0.6 centimeter. If any vegetable is 0.5 or 0.7, she is having anxiety. This is called as OCD of symmetry. Suppose if a person is having intrusive thoughts, intrusive. So what is the meaning of intrusive thoughts? Weird thoughts. Like suppose if a person is having this kind of thought that he is having sex with the God, obviously this is weird, right? So these are 4 major symptoms. But what I anticipate, 5 new types of OCD are added in ICD-11. I anticipate one question from here. Hoarding means what? To keep on accumulating. Obsession of accumulating old stuffs. A person, see, suppose if a person is having this kind of obsession, see here, obsession of losing something important. So for last 15 years, a person has not discarded anything. He or she keeps on accumulating that thing. Right? Because he is having obsession that I might miss something, I might lose something, right? This is hoarding disorder, type of OCD. The type of OCD. Body dysmorphic disorder. See, a person is having OCD of any body part, right? Especially like a female. Again and again, she's looking herself into the mirror. Oh my God, I've become fat. Oh my God, my nose is deviated. Oh my God. See what is happening with her. See, there is no black eye, but she keeps on looking herself into the mirror. Body dysmorphic disorder. Remember here, even some kind of behavior disorder like skin excoriation disorder. Ideally, if you are getting only one pimple, you should not touch it. But what do? See, every time we keep on doing like this and we keep on scratching, no? So this is skin excoriation disorder. See, even if there will be dead skin, leave it, but every time we keep on doing like this, skin picking, skin excoriation, this is a type of OCD. Remember here, now hair pulling disorder, now it is called as a type of OCD. Okay, hair pulling disorder is called as a trichotillomania. After that, person can eat hair also. That is called as what? Trichophagia. After that, see, in the stomach, in GIT, there can be accumulation of hair ball. Okay, that is called as what? Bezoar. This is important. This picture is extremely important. Whenever I say bezoar, this is very, very important topic. Remember here, after that, yes, what is the final management? Surgical removal. Okay, surgical removal, very, very important. Okay, fine. See, remember here, we have learned all these. One more, olfactory reference syndrome. Olfactory means smell. A person is having obsession that he is emitting foul smell from his mouth or from his body. So whenever he will be meeting someone, he will maintain distance. Right? So this is called what? Olfactory reference syndrome. Hypochondriasis is an important topic. Obsession of having a disease. A patient keeps on coming to you again and again. So basically what is happening here, in spite of negative result, in spite of reassurance by the doctor, here patient is asking doctor, please check. Hey doctor, I think something is wrong. in my body. Please do the X-ray of my entire body now. So see here, so basically illness, anxiety disorder, nothing is there. But he is having this kind of idea, I think I'm having some problem, that is hypochondriasis. Old classification like a somatic disorder, unexplained disorder, but new classification, this is a type of OCD. This is important topic for your exam. Okay, next. Okay, see, most important topic in the 27th, alcohol. Okay. See here, methanol poisoning. What is antidote? Dr. Asif Ni, factitious is different. Factitious illness means what? When a patient is faking the symptoms to get hospital attention and hospital admission. Okay, that is factitious illness. If patient is faking the symptom, it is called as Munchausen syndrome. When a caregiver is faking, it is called as what? Munchausen syndrome by proxy. Okay, Dr. Asif. See, in hypochondriasis, here patient is having this kind of feeling. He's having some ideas. Something is wrong. But in factitious, patient will fake the symptoms. Methanol poisoning, what is the treatment? Yes, we can use ethanol, omeprazole. What is answer here? After 3 days. Remember this, very, very important topic. See here, like alcohol withdrawal symptoms is always an important topic, very, very important. First symptom will start after 6 to 8 hours. 6 to 8 hours. So first symptom is what? Tremors. Okay, second, after 12 hours, okay, there can be what? Hallucinosis, especially auditory hallucination. Right now, see here, so when a person has stopped taking alcohol, after taking the, see here, after stopping the alcohol, after cessation of alcoholism, after 24 hours, what can be there? Yes, there can be seizure, cluster seizure, GTCS, rump fits. After 48 hours, person will completely be disoriented to time, place, and person with agitation, irritation, severe hallucination. This is called as what? This is called as, this is very, very important for your exam. This is called a delirium tremens. Along with this, yes, patient can have visual hallucination, maximum visual hallucination, then auditory hallucination or a tactile hallucination. Please write down, when I talk about delirium tremens, no, see, this is an emergency. This is an emergency. If you do not treat delirium tremens on time, mortality rate will be 20%. So how to treat? You have to give the injection of benzodiazepine, especially you can start with the 𝗬𝗏𝗻, right? Benzodiazepine and vitamin B1 injection. Thiamine deficiency will be there, no? So you have to give the injection of 𝗬𝗏𝗻 and what? Vitamin. Question is that in alcoholism, because of deficiency of vitamin B1, what are the most important disorders, neurological disorder you are suspecting? Vitamin B1 deficiency. One is 𝗬𝗏𝗃𝗃's encephalopathy. Yes, 𝗬𝗏𝗃𝗃's. And second is 𝗬𝗏𝗃𝗃. In 𝗬𝗏𝗃𝗃's, what kind of symptoms you see? Global confusion, 𝗵𝗃𝗃, ataxia. 𝗬𝗏𝗃𝗃's is acute and this is emergency condition. So how to treat? You have to give the injection of vitamin B1 as soon as possible. But when I talk about 𝗬𝗏𝗃𝗃 psychosis, no, this is slow and progressive. You can see anterograde amnesia, and especially there is something that is called as confabulation. What is the meaning of confabulation? Making false stories to fill the memory gap. Remember, 𝗬𝗏𝗃𝗃's is very, very important. Which nerve damage? Ophthalmoplegia, sixth abducent, especially abducent cranial nerve. Now, next important topic, how to manage alcoholism. How to manage alcoholism. First of all, detoxification. Okay, so you have to give a substitute of alcohol, benzodiazepine with vitamin B1. Which benzodiazepine is the benzodiazepine of choice? Answer, please. Yes, you can use, see here, the benzodiazepine of choice, the 𝗪𝗏𝗪𝗏𝗪𝗏𝗪𝗏𝗪𝗏𝗪𝗏𝗪𝗏. You can also use diazepam. You can also use diazepam. But keep in mind, remember here, these drugs are used only when liver function test is completely normal, because these are long-acting drugs. How much is the half-life? Half-life is 12 to 24 hours for 𝗪𝗏𝗪𝗏𝗪𝗏𝗪𝗏. For diazepam, this is what, how much is the half-life? 10 to 12 hours. So if examiner is mentioning, see here, if a liver function test is abnormal, which benzodiazepine should be used? You should use benzodiazepine which love liver. Lorazepam and oxazepam. Lorazepam and oxazepam. Short-acting drugs, half-life is only 3 to 4 hours. Remember, short-acting benzodiazepine has more dependency than a long-acting. Suppose if a person has taken overdoses of benzodiazepine, so can you tell me what is the antidote of benzodiazepine poisoning? Antidote of benzodiazepine poisoning? Flumazenil. Flumazenil. So this you have to give for 7 to 14 days, but after that, most important will be what? After that, maintenance of abstinence, that he should not take alcohol again, right? So deterrent drug, that is called as a disulfiram, which can cause a disulfiram-like reaction, which can cause disulfiram reaction. See, disulfiram blocks which enzyme? Aldehyde dehydrogenase enzyme. So there will be red rashes, nausea, vomiting, headache, low BP. Patient can go into shock and seizure. Patient can have seizure. Patient can die also. That is called a disulfiram reaction, right? So basically, disulfiram is a dangerous drug. So that's why it is what this is called an aversive or deterrent drug. Disulfiram should never be given to a patient without consent. Right? It is dangerous. So that's why anti-craving drugs means even in between, if a person is going to take After that, he will not be having craving. So can you tell me what are the anti-craving drugs you are able to recall? Anti-craving drugs. One is called as naltrexone, acamprosate, topiramate, right? Okay, fine. See, even the baclofen, fluoxetine, anti-craving. Next, okay, 28. Most important topic. Second is what here? Opioid. See, substance abuse. First, most important, alcohol. After that, opioid, and then bhang ganja. After that, cocaine, right? Cocaine, and then cigarette smoking. Anti-smoking drug. Are you able to recall anti-smoking drug? Anti-smoking drug. Okay, one is called what? Varenicline. And second, bupropion. Yes, varenicline and bupropion. And varenicline is best. But remember here, varenicline is given with black box warning. Why? Because it can cause neuropsychiatric symptoms, suicidal tendency. But overall, varenicline is best. Okay. Opioid like morphine, heroin, and methadone, codeine. Question, what kind of question? First of all, first question, what I am expecting here? Flu-like symptoms. Flu-like symptoms is seen in withdrawal from which substance abuse? Rhinorrhea. Flu-like symptoms means for running nose, running eyes, right? No? Rhinorrhea, lacrimation. There can be what? So there can be diarrhea and all. Opioid withdrawal. Opioid withdrawal. How will you understand that patient had overdose of opioid? CPR mnemonic. CPR. If patient is in coma, if there is pinpoint pupil, and if there is respiratory depression. Respiratory depression. Respiratory depression is very dangerous. Obviously, patient will die because of respiratory depression. So remember this CPR, if you can see these symptoms are there, yes, person is because of what? See here, overdoses of heroin, he has taken heroin, right? Easy to understand. How to treat? What is the antidote for opioid poisoning? Antidote for opioid poisoning? Naloxone. Short-acting drug, naloxone. For relapse prevention, you can give naltrexone. When I talk about one more drug, cocaine. Okay, cocaine. Please remember here. First of all, cocaine is going to increase the level of all neurotransmitters, serotonin, norepinephrine, dopamine, acetylcholine. So after cocaine, remember here, cocaine and amphetamines, these are CNS stimulants. So person will become hyper. See here, so everything will be elevated. Everything will increase. Hypertension, heart rate will increase. Right now, easy to understand. Cocaine is also going to cause a vasoconstriction. Vasoconstriction. So there is high risk of nasoseptal perforation. Nasoseptal perforation. Orally, if he is going to take, black pigmentation over the tongue. Jet black pigmentation. Basically, क्या है यहाँ पे? See here. Remember here, cocaine can cause a vasoconstriction also. No? So there will be what? Vascular insufficiency. Vascular insufficiency. High risk of myocardial injury, seizure. There can be suicidal tendency. And because of cocaine, yes, there can be tactile hallucination. Okay. Now one more drug, cannabis. Overall, this is the most common illegal drug worldwide. What is the active ingredient of this? THC, delta 9 THC, THC. Remember here, THC means what? Tetrahydrocannabinol. After intake of, so basically when I talk about this one, or when I talk about cannabis, remember here, I'm talking about bhang, ganja, hashish, hash oil. Same, all these we are going to derive from this plant only, hemp plant. Remember here, see here, so when a person is going to abuse bhang, what will be the symptoms? Remember, red eyes, increased appetite. Alone he can eat 4 to 5 plates biryani. After that, what? Depersonalization, derealization, like feeling of, feeling of floating in the air, feeling of, like stopping of the time. Synesthesia. Here patient can say, I can watch music, I can hear light. Right? All these symptoms you are going to see after abusing bhang. Okay? Fine. Remember, running amok. There is something important, run amok. What is this run amok? Run amok. A person who was abusing bhang a lot now, he will get this kind of rage, this kind of aggression that he will start running on the road, and he can hurt a person, he can murder a person also, but there will be no punishment because running amok is considered as a disorder of mind. Okay. Second last topic, autistic spectrum disorder. See, remember here, when I talk about a child, if a child is having a lack of attention, hyperactive and impulsive, he will be called as a case of ADHD, attention deficit hyperactivity disorder. Right? And remember here, ADHD, for this drug of choice is 𝗬𝗏𝗏𝗏𝗏. Look at this, you have lot, 𝗬𝗏𝗏𝗏𝗏. Remember here, but whenever examiner is mentioning when a child is having difficulty or impairment in social interaction, language and behavior, this will be called as a case of autism. Multiple disorders in the same group, autistic spectrum disorder. Let's learn here, very, very important. Remember, when there will be social interaction problem, language, behavior, means there can be stereotyped behavior, means like banging head, right? Or like hitting self, scratching self. Mental retardation, IQ problem can be seen in approximately 35% of kids. All autism are much, much more common among boys. Okay, fine. So when there will be problem in all these, okay, this will be called as autism. Social interaction problem means what? There will be poor eye contact, lack of social smile, inability to make friends. Remember, same symptoms like autism with the microcephaly. Microcephaly means what? Size of head became small. After that, there can be seizure. After that, there will be loss of acquired skills after 5 months of age. There can be breath holding spells. Remember here, all autistic disorders are more common among boys, except Rett syndrome. This is exclusively seen only in female. Mutation in gene, which gene mutation? MECP2. MECP2. Up to last year, there was no any medicine for Rett syndrome, but there is a new medicine for this. What is the name of that medicine? This medicine you should be knowing, trofinetide. Okay. Now, same symptoms like autism with the loss of acquired skills after 2 years. Basically, a child, whatever he has learned, he will start forgetting everything. So that's why it is called as what? Regressive disorder, or dementia infantilis, Heller syndrome. And there will be loss of bowel and bladder control. Bowel and bladder control. No treatment. Asperger's syndrome, remember, IQ, language, both are normal. Okay, but social interaction abnormal. Social interaction abnormal. Movie name, my name is Shah Rukh Khan. So he was suffering from Asperger's syndrome. Learning disability, IQ, language and social interaction, all are normal. But whenever he is writing the exam, he is getting failed. learning disability like dyslexia. That movie Taare Zameen Par, right? So where there is difficulty in reading, writing, and mathematical ability, all these you have to memorize. Now, last topic which I anticipate a question from the new drugs. Remember here one new drug. Okay, this is for Rett syndrome. Rett's. And remember here where we are using 𝗬𝗲𝗹𝗵. This is the first oral drug for postpartum depression. Postpartum depression, oral drug. One more drug is there that is called as a brexanolone. Brexanolone. For postpartum depression, I'm saying depression. Brexanolone. But this is given through IV route, 60 hours continuous injection. So there is only one oral, and this is the newest drug for postpartum depression. Postpartum depression, that is 𝗬𝗲𝗹𝗵. 𝗬𝗲𝗹𝗵. Very easy to understand. So, okay. Yes, I hope we have learned so many things, and like these Super 30 topics, these are most anticipated topics. So इसके बारे में जो है आप लोग जितना भी है, so first of all, please go through all these, and yes, we are going to revise all the things in so test and discussion also. Right? See, whenever there will be aphasia, see, aphasia means what? Aphasia means what? Whenever there will be anatomical damage. After that, if a patient is mute or silent, that is called the aphasia. But alogia means what? Psychologically, if a person is mute, that is called as alogia. Right? So do well all these Super 30 topics, whichever I have revised today. So these are important topics. Please go through easily. You can solve 5 to 6 or 7 questions also. Thank you so much. Good night.